Thank you, Chairwoman Eshu. Last week, we held a legislative hearing to examine bills that would improve the health of children and families, and today the subcommittee meets to discuss a slate of bipartisan bills that seek to strengthen America's health workforce and support our communities and providers. The legislation before us now would foster a robust public health workforce and provide support to those who fought on the front lines of the COVID-19 pandemic. Now, throughout the pandemic, physicians, nurses, scientists, contact tracers, community health workers, and many others have worked tirelessly to attend to the needs of patients and to promote the health and well-being of our communities. And it's a tribute to their selfless work over the last 18 months that we're gradually approaching a new normal, but we're not out of the woods yet. The pandemic has stressed our healthcare system, with many healthcare workers suffering from fatigue and burnout, and unfortunately, some workers are leaving the workforce entirely. Historically underserved areas, rural and tribal communities in particular, are suffering from a lack of access to basic public health services and are experiencing workforce shortages. There's also an alarming trend in the mental health of healthcare professionals. An April survey from the Kaiser Family Foundation and the Washington Post found that a majority of frontline healthcare workers say that stress related to COVID-19 has had a negative impact on their mental health. And that same survey found that only 12% of healthcare workers received mental health services. An additional 18% reported that even though they thought they needed care, they did not seek it due to busy schedules, stigma, fear, or financial concerns. Now, these issues demonstrate the need for broad investments and support for our healthcare workforce. This includes resources to recruit and retain talented health professionals and protect their mental well-being going forward. And the 7 bills before us today recognize the urgency of these issues by addressing the mental health burden faced by frontline workers, creating incentives and novel pathways for services to underserved communities, strengthening workforce capacity so we can meet future public health emergencies head-on, and incorporating the needs of caregivers for Alzheimer's patients. Just wanted to mention the bills H.R. 1667, the Dr. Lorna Breen Healthcare Provider Protection Act authorizes grants for mental and behavioral health training for healthcare workers. It also authorizes grants for its programs and campaigns to improve the mental health and resiliency of healthcare providers. This bill was named for Dr. Lorna Breen, the medical director of the emergency department at New York Presbyterian Allen Hospital, whose family is here to provide testimony on the bill, and I want to thank them for being here today. 2 of the bills before us aim to build a more diverse and community-based healthcare workforce. H.R. 5594, the Enhancing Community Health Workforce Act, would improve health outcomes in medically underserved neighborhoods by investing in outreach to community health workers. And then there's H.R. I guess it's 3520, the Allied Health Workforce Diversity Act, that seeks to increase diversity in the physical, occupational, and respiratory therapies, as well as audiology and speech-language pathology professions. And this legislation would basically authorize grants for scholarship stipends and recruitment and retention programs for students from underrepresented backgrounds. We're also considering bills that would provide guidance on how to expand our pandemic response and strengthen workforce resiliency. H.R. 3297, the Public Health Workforce Loan Repayment Act, establishes a student loan repayment program for public health professionals that complete a period of full-time employment with a state, tribe, or local public health agency for at least 3 years. And then there's H.R. 5602, the Biopreparedness Workforce Act, that helps grow the infectious disease workforce by creating loan repayment programs for healthcare professionals who spend at least half of their time engaged in biopreparedness and response activities. And they'll also be eligible if they provide infectious disease care in a shortage designation area, underserved community, or federally funded facility. And then the last bill, H.R. 1474, the Alzheimer's Caregivers Support Act, authorized additional funding to expand training and support services for unpaid caregivers of people living with Alzheimer's disease. So obviously these are all important. We'd like to move them forward, and I look forward to our discussion and hearing more from the panel, Madam Chair. Thank you again, Ms. Eshu.